Good evening. I am Roberto Santamaria, your host this evening for Nantucket Pulse programming made possible by Nantucket Cottage Hospital's Community Health Initiative. This is a special edition of Nantucket Pulse program that will air weekly covering the coronavirus impacts for the island and will provide urgent updates as they unfold. Today's episode is being filmed at 10:30 a.m. on Friday, May 22nd. Before we begin, I want to remind our viewers that the town election is Tuesday, June 16th, and the annual town meeting is Thursday, June 25th. Over the past 2.5 weeks, we have seen just one new confirmed case of COVID-19 on the island. The current count stands at 14. Today, I'm happy to welcome several guests to the show. We will start out with a statement from the hospital with Cottage Hospital Public Information Officer Jason Graziadei. Then, I am excited to interview both our State Senator Julian Sears and our State Representative Dylan Fernandez. Finally, we will hear from Steamship Authority spokesperson Sean Driscoll as we talk about the worker at the Nantucket terminal that tested positive for COVID-19 and the current state of the company. Let's begin with the ending of the Massachusetts stay-at-home advisory this past Monday. It has been replaced with a safer-at-home advisory. This advisory makes up part of the first phase of Massachusetts' 4-stage plan to reopen the Commonwealth. Phase 1 will last a minimum of 3 weeks. Government and medical professionals will use data to track the spread of the virus and trigger the next phase based on the metrics they are seeing and what nearby states plan to do. As you can see on the graph on your screen, these officials must balance viral risk and economic reward. Each phase permits an additional band of activities that have progressively lower economic benefit and higher viral risk. The goal is to avoid low-benefit activities that would easily spread the virus until its threat diminishes. We will now share 3 tables summarizing the 4-phase approach. Let's run through what safer at home means for the public. No groups over 10 may congregate, except in locations I will mention later, and only when people maintain social distancing among the other attendees that don't live with them. People over 65 and those who have underlying health conditions should continue to stay at home unless they must perform essential errands. The advisory encourages all other people to leave home only for healthcare, worship, permitted work, shopping, and outdoor activities. Everyone over the age of 5 must wear a face covering when they cannot maintain a social distance in public, such as in stores. The Massachusetts government advises people to limit play dates for their children, wash their hands frequently for 20 seconds with soapy water, avoid close contact activities like pickup sports games, communicate remotely with tools like video chat, and to be on the lookout for COVID-19 symptoms like cough, difficulty breathing, fever, chills, muscle pain, sore throat, or a change in taste or smell. For more information, please visit the link describing the advisory in the description. What does Phase 1 mean for businesses? The answer depends on the business. A few new rules apply to all of them, however. All businesses must complete a COVID-19 control plan template and keep a copy on premises, but do not need to submit it to anyone. They must print, sign, and post a compliance attestation poster. They must display employer and worker posters describing social distancing, hygiene, and cleaning rules and advice. All these materials are available at the link at the bottom of your screen and in the description. Look for the heading General Business Guidance. Essential services remain open. Currently, restaurants can offer curbside pickup and delivery. Non-essential retail stores can only deliver items to customers' homes while maintaining a social distance. The following establishments may now open: banks, places of worship, in-house services like nannies, painters, etc., home remodeling businesses, real estate open houses, and hospitals may expand their services to, quote, high-priority preventative services, pediatric care, and treatment for high-risk patients, unquote. All houses of worship must limit their occupancy to 40% of the building's maximum capacity. All attendees that are not part of the same household must stay 6 feet apart. All attendees over 5 years of age must wear face coverings. Ample ventilation, easily accessible alcohol-based hand sanitizers, and an online registry of expected attendees are recommended. The full list of requirements and recommendations for houses of worship can be found at the link in the description. Starting on May 25th, office spaces, hair salons, drive-in movie theaters, barbershops, car washes, and pet grooming businesses are permitted to open. Starting on that date, curbside delivery is permitted for non-essential retail, auto shops, and libraries. To see a summary list of what businesses can open, when and under what restrictions, please visit the link in the description. State beaches open on May 25th. Nantucket beaches technically don't open with lifeguards until June 15th, but no one will turn you away if you visit now. Once they officially open on June 15th, they will follow the state beach guidelines. The state guidelines currently are that beachgoers must wear face masks when they cannot maintain a social distance of 6 feet apart from people they do not live with, but not in the water. No groups larger than 10 are allowed. On the beach, toweling and beach blanket areas should maintain a social distance of 12 feet. Everywhere else, 6 feet is acceptable, including in the restrooms. This means that if you do not live with your individuals in your social group, you should stay 6 feet apart from them. Organized ball games are prohibited. For over sand vehicles, at least 15 feet should be left between parked cars. The Nantucket Boat Basin is open. Launching boats from Nantucket boat ramps is permitted as long as you stay 6 feet apart from people you don't live with and wear face masks when that is not possible. To see a full list of outdoor recreation guidelines, please visit the link in the description. In order to fall more closely in line with the Commonwealth's directives, the Nantucket Board of Health has eliminated most of the emergency orders. The only orders that remain active are orders number 4 and part of number 3. Order number 4 extends all recreational shellfish licenses that were set to expire on March 31st indefinitely. Order number 3 is the island stay-at-home order that restricts what businesses may remain open. All of that order's languages no longer applies, except Nantucket is maintaining all carry-out purchases at restaurants occur outside the establishment. No customers should eat the food at the restaurant or at any other gathering site. Please remember, although most of the town's orders are inactive now, that does not mean many similar policies aren't in effect. All of the Massachusetts rules and restrictions are in effect on Nantucket, and many of the Commonwealth's policies overlap with the Nantucket emergency orders. For example, Nantucket Emergency Order Number 7 requires masks in public. Order Number 7 is no longer active, but the Massachusetts Safer at Home Advisory is active and requires the same measure. Construction and landscaping on the island are no longer governed by the Nantucket Emergency Orders 1, 5, 8, and 9. Companies simply need to follow the Commonwealth's rules, but with one exception. Although the restrictions to construction in Order 8 and the landscaping restrictions in Order 9 no longer apply, the Nantucket guidelines do. So every site should still have a COVID-19 officer. There is still a limit on the number of workers. Up to 6 workers plus 1 COVID officer can show up to a site at any given time. It doesn't matter how many of those 6 are landscapers and construction workers. Any of Order Number 8 and Order Number 9's languages outside of the guidelines, like restrictions to the type of project, the permit date, and the approval requirements, no longer apply. To see the Nantucket guidelines, please visit the links in the description. The Nantucket Select Board hosted an emergency meeting yesterday to approve funding for 2 hospital studies. The first study is a random sampling of blood serum of visitors to the hospital who are already seeking blood tests. This study is called a serology study and will look for antibodies for COVID-19 that signified the person had recovered from the virus. The hospital will run the study in partnership with the Broad Institute and to give the community a baseline of viral prevalence going into the summer. The second study will expand PCR testing for COVID-19 to individuals prioritized by the Board of Health. This testing assesses whether a person currently has the virus. The hospital previously has restricted testing to symptomatic individuals. The Select Board and Finance Committee allocated $261,800 to the serology study and $50,000 to the PCR study, with the provisions that I oversee the study and that the hospital seeks to fundraise enough money to pay half of the town's contribution back. Now here is Jason with a pre-recorded statement.
Hi, I'm Jason Graziade, the Public Information Officer for Nantucket Cottage Hospital. As the state of Massachusetts begins to reopen and Nantucket Cottage Hospital resumes service lines that had previously been on hold, we want to share our safe care commitment to the island community. This safe care commitment is based on 3 pillars. 1, we screen to protect you, your families, and our staff. 2, we clean our hands and spaces and make it easy for you to do the same. And 3, we protect everyone in our environment. So let me explain a little further about these 3 areas of focus to keep our patients safe. On screening, we screen all NCH employees daily, so anyone with symptoms of a possible respiratory illness is not allowed to work until they are better. We screen on arrival all patients and visitors for symptoms of possible COVID-19 infection. Admitted patients are also tested prior to admission and screened daily. We limit visitors coming into the hospital and clinics and screen for symptoms of possible COVID-19. We ask all visitors with symptoms to defer their visits. With regards to cleaning, we have increased the frequency and intensity of cleaning of all high-touch areas throughout the hospital. We require frequent hand cleaning and have added hand sanitizer stations so patients and staff can clean their hands easily and frequently. And finally, we protect everyone in our environment at the hospital. How do we do that? We require all people on campus, employees, patients, and visitors, to wear a mask. We have also rearranged spaces inside the hospital to accommodate physical distancing and prevent transmission of hidden infections, and in some high-use areas, we have installed plexiglass barriers. So all these measures have been implemented to give our patients confidence that they can safely come to the hospital for care. Please do not delay your care or ignore a pressing health issue. NCH is open, safe, and ready to care for you. One final note on testing for COVID-19 at NCH. Infection control experts have been collaborating across our system to continually evaluate and update our COVID-19 testing criteria based on our assessment of clinical priorities and our testing capacity. We want to remind everyone that the testing criteria at our drive-through evaluation site at the main entrance of Nantucket Cottage Hospital has been loosened to include all patients with active COVID-19 symptoms. That means anyone with one or more of the signs or symptoms consistent with viral respiratory syndrome would meet criteria to be tested. And those symptoms include fever, sore throat, cough, runny nose or nasal congestion, shortness of breath, muscle aches, or a loss of sense of smell. So we are encouraging anyone with one or more of these symptoms to come to our drive-through for an evaluation by our clinical team. There is no need to call ahead. We are currently working with the Town of Nantucket Health Department to evaluate how best to expand testing in the weeks and months ahead, and we are grateful for and appreciate the Town Finance Committee and Select Board's recent votes to dedicate additional resources towards this effort. So stay tuned on that, and we'll have more details soon. On behalf of everyone at Nantucket Cottage Hospital, I want to say thank you to the community for its continued support of NCH and all of our healthcare workers.
And today we have Senator Julian Sears, Senator for the Cape and the Islands. Julian, how are you doing today?
So good to see you, be with you. Thank you for having me. I'm all right. We're very busy. I don't think I've ever been this busy in this position, and I think we try to work always hard in my office, and I'm someone who grew up waiting on tables, so I know what it's like to work in the weeds there. But we've been busy really trying to respond and go to bat for Nantucket and the whole region.
An economic impact survey featuring responses from over 440 Nantucket businesses indicated that the number one form of support they would like is financial support in the form of grants, loans, delayed rent payments, and delayed tax payments. Does the Commonwealth have any plans to offer such an assistance?
So there's a number of things that the state has already done. There's several things we're looking to do. And then there are some pieces really where the federal government is key. So when it relates to rent and evictions and mortgage forbearance, the legislature took pretty swift action and passed a law that actually prohibits evictions for the duration of the pandemic, allows for mortgage forbearance for those who are struggling to pay their mortgage, and provides some really good protections that help people. In addition, there's been some dollars in small business assistance that have flowed to folks, but a lot of the financial support really is coming from the federal government. And there's some programs that have helped some island businesses and some island individuals, but really they're crafted, whether it's the federal payroll protection program or the SBA loans. They're really crafted. They don't really envision the needs of they don't envision a seasonal economy. So, for instance, the payroll snapshot that you get in the PPP program only runs until May 15th. Well, if you are owned a business like my family's, you didn't open until Memorial Day weekend. You wouldn't have payroll, until in that snapshot period. So there's some uneven, the inconsistencies there. I think have really left our community out. I've elevated these issues. I spoke to Senator Warren about this issue directly, and Congressman Keating as well, and Senator Markey, and hopefully we'll get some fixes and changes. As far as other support, there's a lot that the state wants to do, but we're really going to need the federal government to step up here with some stimulus.
And how do you, as a state senator, strike a balance between the Commonwealth offering much needed support and falling into debt?
So the Commonwealth, we can't deficit spend as a Commonwealth. We have to pass a balanced budget under our Constitution. We will take out and we will borrow. We've borrowed some money here. Broadly, the Commonwealth of Massachusetts is in a pretty strong fiscal position. Before this, we had a rainy day fund that had an excess of $3 billion, a very strong bond rating. And we're going to dip into those reserves. But, really, we're going to need help from the federal government. Without the federal government stepping in, we'll be making cuts to first responders, to teachers, to local aid, to a myriad of the health and safety programs that are so crucial in this pandemic. And that's why federal action is absolutely key.
For the restaurants, what form will restaurants' guidelines be taking this summer? Will it be in limitations in terms of occupancy numbers, or limitations ensuring just 6 foot of separations among customers?
Most of the activities in our hospitality and tourism sector, which islanders are very interested in, most of those activities happen in phase 2 or phase 3. Most of them are phase 2. So we are going to be in phase 1 for a minimum of 3 weeks, and in each phase will last a minimum of 3 weeks. So, the earliest that phase 2 would start would be June 8th. Restaurants, especially dine-in restaurants, are part of phase 2. And so we're still waiting for guidance on what that would look like. I expect it's going to be criteria for all employees in the restaurant and workers in the restaurant to be taking certain precautions. I likely expect that spacing is going to be involved, spacing between tables, protocols around how to clean. Those haven't been finalized yet at the state level, but we're eagerly awaiting them. I'm keenly aware, as someone who grew up in the restaurant industry, that businesses are going to need some lead time to actually be able to comply here. So, if you're told on June 8th that you can open on June 8th, that doesn't do you a lot of good, because you got to order supplies, you got to order your food, you got to put protocols and training in place. Right now, if you go to mass.gov/reopening, there's a sample COVID-19 control plan that every business is going to have to use. There's a sample attestation that businesses are going to have to display to say that they've met all the criteria and standards. So if you're a business owner in any sector, I'd encourage you to look at those and start planning now, and then hopefully we'll have further guidance on how restaurants can safely reopen in the coming days.
And then what guidance can you offer folks from out of state thinking of visiting the island this summer? Right
now, for our visitors, particularly out-of-state visitors, really encourage you to look at the guidance that the governor has. Out-of-state travelers are urged to do a 14-day quarantine if and when they come to Massachusetts from another state under phase 1. So that travel advisory actually has been consistent through the pandemic and continues through phase 1. So there's a lot of uncertainty, though. The timeline here in when we're going to be able to reopen further and transition from phase 1 to phase 2 and then phase 2 to phase 3 is really going to be based on public health and on the surveillance data that we have around how the virus is behaving. So we ask for your patience. Folks are, if you do have a place to stay now, you are able to come. We just ask that you follow some pretty common sense guidelines, doing a 14-day quarantine, using, curbside or contactless pickup or delivery if you need to do, shopping for groceries and those sort of items. And then just to really stay tuned to follow the forthcoming guidance that we expect for subsequent phases.
And Julian, why hasn't testing been available to anyone who wants it? What plans does the Commonwealth have to increase testing?
Testing is absolutely crucial. We need to understand and have the ability to have testing on demand. Essentially, if you want to test and need a test, you can get a test. And that's also followed with a robust contact tracing. The problem really has been a supply chain issue, so that we haven't been able to consistently get all of the kits and the swabs that are needed to do this. There's a plan to continue to ramp this up. I'd really like to see, and I'm urging that Nantucket and the entire Cape and Island region have on-demand testing, particularly for our summer season, where we may have a number of visitors who are here in the region. They probably don't have a relationship with a primary care physician or a doctor or hospital, where they typically get care. And so on-demand testing, I think, is really crucial and important. We don't have it yet, but I think it's really something important that we need to have.
And then, based on what you've heard from the Reopening Massachusetts Committee, what do you think the summer will look like here?
We're cautiously optimistic that we'll have a summer season. I think a successful summer, first and foremost, is one where we don't see an uptick in cases, either in community spread among the community who's here, sort of among our seasonal residents, and we're not seeing spread among visitors as well. So I think success, first and foremost, needs to start with public health metrics. I think, more broadly, I think any opportunity that folks have to be open and to make some business is good. And just realizing what a difficult and uncertain, I want to acknowledge rather what a difficult and uncertain time this is. And we don't really know what the season will be, although we're cautiously optimistic. I think that we'll have some sort of season. It's just going to look a little different.
And how will the Commonwealth release updates and help businesses prepare?
I think staying tuned to mass.gov/reopening. If you go to that website, there's a whole myriad of information, sector by sector, around how various sectors need to comply and to keep people safe. So I think stay tuned there. You also can visit senatorsear.com/reopening. That's senatorcyr.com/reopening. And we've got a lot of information up there as well. So those are two sources where you can stay up to date. The sector by sector information, much of that has already come online, and my expectation is that more of that will come. We've also formed, sort of less specifically relevant to Nantucket, but from a Cape Cod perspective, we formed a Cape Cod reopening task force, and we're really trying to collaborate, make sure that we're using a uniform message. We're in touch with our partners on Nantucket, whether it be the town, the Nantucket Chamber of Commerce, and others, and freely sharing that information. We're really broadly kind of one region, particularly our visitors see us as one region. And so I think it's really important that we're speaking with one voice.
So, Julian, a few hypotheticals. If there are only a handful of additional confirmed cases on Nantucket by July, can the island relax some of the Commonwealth's restrictions unilaterally?
No.
Julian, one last question for you. What support could the Commonwealth offer if Nantucket becomes inundated with COVID-19 infections this summer?
We're working very hard, particularly in close communication with Nantucket Cottage Hospital and the town, Roberto, you know this, to make sure that we're really prepared in the event that we see an uptick in cases on island. This is why, a number of the precautions that we've taken, the travel advisories and others, I think are so essential. I think we should be really proud of what's, of the lack of cases broadly we've seen on Nantucket. That's a real win. It wasn't necessarily what we expected, but we're going to have to do a lot to keep that up. And that's going to become more and more difficult, as there's a little more complacency here. I think personal responsibility is absolutely key throughout this, to make sure that people are following public health precautions and that we're keeping everyone safe.
Well, Julian Sears, State Senator for the Cape and the Islands, we really appreciate your time. We know you're a busy person, so thank you for spending time with us today. We really appreciate it.
We're trying to do everything we can to be speaking as one voice as a region, to be going to bat for our issues, to be taking an approach that is public health led, but also understands, the importance of restarting our economy. Certainly rely on me and Representative Fernandez as a resource. And I just really thank you for the opportunity tonight and enjoy the long weekend.
Today we have Dylan Fernandez, our state representative for the Cape and the Islands. How are you doing today, Dylan?
I'm great, Roberto. How are you?
Pretty good. We're going into the long weekend, so we're pretty happy about that. So I'll go ahead and just jump right into the questions. Based on what you've heard about all this reopening Massachusetts committee, what do you think the summer's going to look like here and on the Cape and in the other districts?
Yeah, well, look, I think we all know that it's going to be a muted summer, and less people are going to come than they normally come. I think that's since March we've kind of most people have thought that. I think it's going to be a real challenge, frankly, to balance public health with reopening and our economy. And so I think it's going to be a tough summer. On the one hand, because less people are going to come. On the other hand, people certainly will need to get out of the house and need a vacation too. So I do expect second homeowners who haven't already come, a number have already come, to come. I do expect once short-term rental is open, that those begin to get filled up. But understandably, people are really concerned. And so there's a number of government mandates and government guidances around restricting activities based on public health, and that's helpful to stop the spread of this disease. But frankly, I think probably the greatest thing restricting people from traveling and from going out and doing the things they normally do is fear of getting the disease. And so at the end of the day, I think the best thing that we can do for our businesses and for our economy is do everything we can to stop the spread. And that means, being really personally responsible and continuing to wear a mask, continuing to clean off surfaces, continuing to stay 6 feet apart and not congregate in large groups. And, if we can all take really strong personal responsibility, I think we'll have a better summer on Nantucket and on the Cape and Islands.
Very good point. It's the muted summer is going to be a big deal, and but you're right. People are getting cabin fever, so it's time to get out. As far as
we're positioned, like the Cape and Islands, people aren't going to be traveling to Europe, right? They're not going to be going abroad, and frankly, they probably want to relax on a beach. So I think on the one hand, a lot of people are going to be looking to come here, but then there's going to be a certain sector that is understandably nervous and wants really strong public health guidance in place so that they can feel safe to come here. And also we want to make sure that, look, Nantucket, Roberta, better than anyone, Nantucket's a healthcare desert. There's not a lot of healthcare resources there. Same with Martha's Vineyard, Cape not too far behind that. So we needed to make sure that we are not having, as the summer kind of heats up, that we're not having outbreaks. Because if we do, then we're going to have to shut things back down. It's going to hurt our economy, hurt our local businesses. And so I think, making sure that, if folks do come here, just like gotta remain vigilant and really have to adhere to the guidance.
Absolutely. As far as the Hill goes, is there any upcoming legislation that's offering support or protection to Nantucket, the islands, and others that you plan on supporting?
Yeah, well, there's a number of pieces of legislation pending right now, and so there's a whole host of business, local business legislation. Just to mention, one piece is around adding in additional seating so that seats could be outdoors. We do know now that, we thought this originally, but we do know now through a couple studies that being outside really does help in slowing the spread of the virus, and really does help in killing the virus. So, allowing for additional seating outside, whether it's in the parking lot or on the sidewalk, for restaurants, allowing that to be streamlined and not having to wait months and months for a liquor license for that is certainly something that I'm a co-sponsor of. There's just a whole there's a whole host of pieces of legislation. I mean, there's about a half dozen on voting, voting by mail, or and casting no excuse absentee ballots. A number of pieces of small businesses legislation. One around, a lot of businesses have disaster insurance, but under their disaster insurance, pandemic isn't one of the categories that they can get reimbursed for. So, one piece of legislation that I'm a co-sponsor of is having that be added in. So there's dozens and dozens of bills. I will say, we've passed a number of pieces of legislation. One of the biggest to kind of help folks stay in their home during this pandemic was around just pausing basically all evictions. So if folks can't pay their mortgage, the banks are not allowed to kick them out of their home. And if folks can't pay their rent, landlords aren't allowed to kick them out either. This will go on until the state of emergency has ended. But as you can imagine, especially as the chief health agent on the island, the last thing we want for public health in this pandemic is to see people kind of lose their housing. That would dramatically exacerbate the situation. And so, that's one of many kind of important pieces. The last thing I'll say on this is that, the House of Representatives, like the Congress, like our federal Congress, the House and the Representatives and the Congress, we control the money, we control the budget, and it is very bleak right now. Massachusetts next year is projecting around a $6 billion deficit and a $42 billion budget. That is a massive amount of money that the state is losing. And in this fiscal year, we're behind by, somewhere around $1 to $2 billion as well. And so that's going to pose some really severe challenges to the state and to organizations that get state funding. So right now, in the legislature, that's something that we're trying to take up as well, is how do we handle the state budget, and how do we forecast for the future, and how do we remain solvent in the near term and keep the bills paid.
Wow. So actually along those lines, now that you mentioned a 15% shortfall, the next question is actually about that exactly. An economic impact survey with responses for about 440 Nantucket businesses indicated that the number one form of support they would like is financial. Does the Commonwealth have any plans to offer that sort of assistance?
Yeah, so I think there's a whole restaurant package that was just released that we're going to take a look at. I think, when it comes to funding, this needs to come from the federal government. And we've already seen that through the CARES Act, where the feds pitched in around $2 billion. A fraction of that came back to small businesses, certainly a good step, but a whole lot more money, trillions more, will have to be released by the federal government if we want to shore up our small businesses and allow them to stay solvent. Like there's no question about that. And we saw this in the financial crisis of 2008, 2009, right? So one of the things the federal government didn't do then was give money to the small businesses, and a whole host of them failed, and a lot of them never came back. We can't make that same mistake again. And another thing that happened in the 2008-2009 crisis was that all the states were going bankrupt as well, and states, unlike the federal government, cannot deficit spend, and so states have to have a balanced budget. So it causes, if the federal government doesn't come in to bail out businesses and the states, it causes a compounding effect for the states, where they actually have to cut spending and raise taxes to be able to balance their budgets, which further advances a recession. And so this is like the last thing that we want and we can afford to have happen for the state of Massachusetts, but really for the entire country. And so, the federal government, I think, needs to understand the scale of this problem. And you see this through the House of Representatives just released, I think, a $3 trillion package. I think a whole lot more is going to need to come if we want to be able to shore up our businesses financially through direct cash assistance, through issues that are kind of regulatory and loosening up, and not even necessarily loosening up, but just kind of responding to the times. That's absolutely something in Massachusetts' wheelhouse, whether it's, relaxing liquor licenses, whether it's allowing for things like carry out beer and wine, like we've already allowed for. I think liquor should be frankly should be a part of that, whether it gets back to that kind of creative outdoor seating and not having to wait months and months for a license to do that, and a more streamlined approach. I mean, there's a whole host of kind of local and municipal regulatory issues that the legislature absolutely should do, and there's already a number of pieces of legislation pending on it. But from a financial, cash infusement perspective, that absolutely needs to come from the federal government, which can borrow, unlike borrow and deficit spend, unlike the states.
So Dylan, what is your opinion on continuing self-quarantine guidance for visitors throughout the summer, and how do you expect that to affect the hospitality and lodging industries?
Hotels, motels, short-term rentals, and restaurants are included in phase 2, certainly, but there's actually a working group that's been established to look into drafting regulations for the hospitality industry before phase 2 commences. So I think there's a very good chance that guidelines for restaurants, hotels, motels, short-term rentals, and the like will be released in the coming weeks before phase 2. It'd be kind of a phase 1.5 of sorts. So I think that's what our hospitality industry can look forward to it. Around quarantine guidance, so right now, the guidance is, 1, it's guidance, and then 2, it's for people coming into the state to quarantine for 2 weeks. I don't think that necessarily, in a practical sense, means that you rent a place on Nantucket for 2 weeks and then you go to your house and then you shutter the door and then you stay in the house. Right? That's not what that means from a practical perspective. I think you can still go to the beach, you can still go on your bike rides or your beautiful hikes. It's just you can't be going to your neighbor's house. You can't be joining large groups of people or even small groups of people. You just you got to stay away from other folks after traveling here for at least 2 weeks to ensure that you're not infecting other people on island. It doesn't mean you can't go down, go take a beautiful bike ride down to the beach and stay separated based on the beach guidance that you and the state have put out. But it just means that you got to take a little more, you got to think a little more responsibly, and you can't be going and visiting and seeing and interacting with other people, because we really need to keep the island as safe as possible, recognizing that there are very limited healthcare resources there.
Last question, Dylan. What guidance would you provide to island towns trying to balance the efficiency of simply following the Commonwealth's restrictions and creating new ones that address uniqueness of island life?
Yeah, look, I think it's really important from just a Cape and Islands perspective that we have consistent guidance. Nantucket's a little different because it's one island, one county, one town, whereas the Vineyard is one island, 6 towns, and the Cape, a whole host of towns. And so it's really important that that particularly the Cape and Martha's Vineyard have consistency among towns, because inconsistent guidance would it causes a lot of confusion. If one beach in Yarmouth has certain beach regs that another beach does that create perverse incentives for people? Possibly. When it comes to Nantucket, where we just have one island, one town, I think there's probably more room there to cater things based on the unique geography of the island and the unique circumstances there. That said, I think the governor's guidance for the most part is well thought out and well reasoned, and certainly based in best public health practices. But there are frankly things in there that probably have room for improvement, and to the extent that islanders, who are grounded in island specific issues, want to make subtle tweaks here and there, I think that would be fine. And again, the governor's, a lot of this is guidance, and so I think Nantucket is 29 miles, 27 miles right out to sea, is positioned to tweak it a little more than other towns and other places do, because you guys don't have any direct neighbors. So, I wouldn't stray too far from it. I think you want to stay as consistent as you possibly can. But look, if there's a Nantucket specific issue that needs to be tweaked there, I think you have every right to do that.
Absolutely. No, we're trying. Well, Dylan, thank you so much for spending your time today. We really appreciate your time. We know you're a busy man. So thank you for...
Always a pleasure. And Roberto, thank you so much for all your work to keep Islanders safe. I mean, you're a rock star, man. And Nantucket is really lucky to have you.
This COVID has really disrupted a lot of lives, so it's going to feel good to get back to normal. Luckily, I shaved my head, so I don't have to worry about the haircut.
I might be behind you on that. Yeah.
And now we have Sean Driscoll from the Steamship Authority, and we'll just jump right into the questions. It seems that the steamship has received good news of about over $12 million in federal aid. In what position would the steamship be in without this money? And what hole does that fill?
We're incredibly grateful, first of all, for the federal aid. And it's a big assistance to us because of the sharply reduced demand for travel right now has put us in a sort of a cash crunch to be able to fund our operations. So that $12 million is going to go a long way towards funding our boats and being able to pay our personnel through the summertime as we work to sort of a longer term solution to help replace the millions of dollars of lost revenue that we are realizing because traffic has been so low through the spring, and especially we don't know what traffic is going to be like for summer and through the rest of the year. And we are a self-funding agency. We don't get any state or federal assistance on a routine basis. There's no subsidy for our services. So, the loss of traffic has hit us particularly hard. So this money is going to be a great relief to us. It buys us a couple of months extra time to be able to work out a more permanent solution for this year.
Sean, what percentage of traffic is the Steamship Authority seeing right now compared to this time last year?
Through the end of April, we were roughly at about 20% of our passenger load compared to the previous year, about 25% of our automobile load, and roughly about 40% of our truckload from last year. Things have taken a little bit of an upturn here in the first couple weeks of May, as the weather's gotten nicer, as the construction moratoriums have loosened up on both islands, and especially that colleges are out and we know that schools aren't going back. We have seen a little bit of an upturn. The curve is bending ever so slightly in a positive direction, but we're still far, far off from where we should be for this time of year.
A question that's on everyone's mind. Why is the Fast Ferry only returning for Memorial Day weekend? When do you think it might return for the whole season?
Well, we're working really hard right now to match our service to the demand levels, and we had enough demand over Memorial Day weekend that we thought we could bring the boat back for just these 6 days to be able to get people to the island and back for the holiday weekend. But after that, there were so few reservations that we really couldn't justify keeping the boat going, even sort of under a theory of if you run it, they will come. So our summer schedule starts in mid-June, and we're hoping that the Fast Ferry would return at that point. But we are keeping, as I said, a really close eye on demand and trying to match our service levels to the demand. So it will depend on sort of where we are holistically in June and what the demand looks like for travel to the islands before we make that decision for sure.
Sean, could you characterize what job duties the employees sick with COVID-19 performed in public areas?
So what I can say is that the employee in question had job duties that would have taken him or her outside of the terminal building. So we can't release too much information because we obviously want to respect and protect that employee's privacy, but it is a job that would have not been confined to the terminal building. It would have been would have had duties that were on and about the property.
And since last week, how many Steamship Authority employees are homesick?
As we're aware, no terminal employees have had to be out sick in relation to this, and none of the vessel employees as well.
Have any other Steamship Authority employees tested positive for COVID-19?
We did have one other employee who's tested positive, but that was someone who's not in a customer-facing role and had been out on an unrelated matter for some time before that test was positive, so there's no risk for exposure to our customers or to anyone on our staff.
Sean, can you please describe how the Steamship Authority will undertake contact tracing in relation to the public and staff that might have come into contact with this sick employee?
Our Health and Safety, Quality, and Environmental Officer has already been working on that effort with regards to our staff, looking back to see when the employee in question traveled, which employees were on during that time, and matching the employees' work schedules with other employees to figure out who this person might have come in contact with. And we've been working and notified, I believe, all those people by this point. And on the public side, we will work with the public health nurses, both on the island and in Barnstable, to undertake that effort. They're a little bit better equipped than we are on the public side. And, we don't collect walk-on passenger names necessarily. So if someone paid for a ticket in cash and walked on the boat, we wouldn't necessarily have a record of that. We may be able to determine some passenger names if they were traveling with a vehicle or if they used a credit card, but to the extent of which we might be able to, get that information is something that we're working to determine what we'd be able to identify.
Will any employee that came into contact with a sick individual be required to get a COVID-19 test? If not, will they be required to self-quarantine for 2 weeks?
So what I can say is that on Wednesday, the day after that we learned about the positive test, we worked with the Hyannis Fire Department and public health officials in Hyannis to be able to provide rapid COVID testing for our employees who might have been in contact with this individual. And I know more than 30 employees came to the Hyannis terminal on Wednesday for those tests. That was not a requirement. We strongly suggested it, but we were not requiring it. But we do have a policy that if someone was in contact with a COVID-19 positive person, that they do need to quarantine for 14 days.
In the event that, God forbid, nearly all of the Nantucket steamship ferry staff becomes sick, what is the company's plan to keep essential deliveries coming to the island?
Well, we would pull personnel from other duties as necessary to staff whatever areas were short. We could pull boats from the Vineyard Line to supplement service if we had to take the Eagle or the Gatehead off. We do have, unfortunately, quite a few employees we've had to lay off who would be able to be called in. So we would, staff up from whatever corner of the organization we had to be able to keep that service running.
And now we'll air a previously recorded video of the COVID-19 report that explains models and epidemiology to the Select Board and the Board of Health that I presented yesterday. Today we will be discussing the COVID-19 report summary. The COVID-19 report and its data follow-up is available on the Town of Nantucket's website under the Health Department's webpage at nantucket-ma.gov. So let me dive right in. First off, the COVID-19 summary that was presented to the Board of Health and the Select Board yesterday and Wednesday gave a quick overview of what Nantucket's early mitigation has done, how many cases there are to date, and then goes over what epidemiology actually is and what models provide. So first off, what is epidemiology? Well, one of the biggest takeaways is that about 6 or 9 months ago, most people didn't even know how to spell epidemiology, let alone what it meant. And now apparently everyone knows at least 3 or 4 of them, or people all worked in epidemiology. So let's just break it down to what it is. The main definition from the Dictionary of Epidemiology is actually up on your screen. But really, in lay terms, epidemiology is the study of illnesses and how they spread in populations. So what does that actually mean? Well, applied in the report, you will see that we discuss models, we discuss what you see in the state applied to COVID, you'll see what we see what we saw globally, what we saw at the state, what we saw at the national level, and now what we're seeing on Nantucket. But really what the biggest takeaways from the report is that models, though we've had a lot of discussion about models, is actually only used to answer very specific questions. And what does that mean to us? Well, in Massachusetts, we're seeing good things, but we still must maintain hypervigilance. We really need to pay attention to what the state is giving us in order to pay attention to the masks, the social distancing, because that is going to keep the surge from actually happening. It helps us flatten the curve. A big situation that we're seeing in Massachusetts is that even though people aged 60 and over are only 37% of the cases, but they account for more than 95% of the deaths. I think if you're paying attention, if you're not in this age range, if you're younger than this, when you're wearing your masks, what you're remembering is that you're saving lives of the people who are 60 and older. By not wearing a mask, by being an asymptomatic carrier, you're actually putting more people than just yourself at risk. It's not an infringement on your rights. More than anything, it's actually we're asking you to not infringe on other people's rights by wearing a mask. And that right is their right to a happy life, a right to life. And then what's more important, the last important portion about what we're doing here on Nantucket is that we're doing very well, but now is not the time to let up to the rules. So where do we go from here? Well, like I've been saying, pay attention to the governor's orders and his phased reopening plans. At the Board of Health meeting on the 21st, the Board of Health rescinded most of its emergency orders to stay in line with the governor's orders and his reopening plan. That way we're paying attention to where things go. With the serology tests and the PCR tests that were approved at the Finance Committee yesterday on May 21st, we are now looking to establish an active surveillance program. The serology tests will tell us where we are. The PCR tests will tell us where we're going. Both of them working together will help us find out where we are in the surge, if we are even having a surge, and how we have flattened the curve, or if we're not flattening the curve, how we can act. It will inform decisions. So most importantly right now, this slide is you need to join in our success. We are creating an educational campaign, and you will see COVID educators throughout the summer in order to help push the information out about why masks are so important, why we need to pay attention to the governor's orders, and why social distancing is so important here too. Many people don't necessarily understand why we're making the decisions we're making, and the COVID educators will be integral in getting that information out to everyone. But again, this is just very quick, very brief overview. So what we would like to say is, if you have a chance, please go to the town website under the Health Department's webpage under the title of COVID-19 Report. You will see all the information that I have given here, plus more. We go into depth on what types of models are important, what modeling can do for us, and it actually discusses all the references in which we're getting this information. It also discusses the future of what this educational campaign, this going hand in hand with the Economic Recovery Task Work Group, is really going to help us coming into this summer. If you have any questions, please feel free to reach out to us at health@nantucket-ma.gov, and we look forward to hearing from you. Thank you. We will continue to provide you with updates on the coronavirus and impacts for Nantucket. Please tune in to Nantucket Pulse, a wellness segment series with new episodes each week. Hosted by Natalie Seminaro, it's designed to connect our viewers with local health professionals that can help us take care of ourselves and others around us. You can watch on Channel 18 and nctv18.org. Please share this with friends and family. It's important that communications remain in place as events continue to unfold and we all remain connected. It's crucial to get the facts from your local news sources such as the Enquirer and Mirror, 97.7 ACK-FM radio, and NCTV Channel 18. Please stay tuned to see a special message to our essential workers from the community. I am Roberto Santamaria, the Director of Health and Human Services for the town of Nantucket. Thank you.